Welcome to VNA Health Highlights, a program of the Visiting Nurse Association of Cape Cod. I'm Jeanne Sarnosky, and on today's program, we're going to learn a little bit more about emergency preparedness. And today's program, we have with us Mary Devlin, who's the manager of the Public Health and Wellness program at the VNA, and also heads up our emergency preparedness team.
Yes.
That's right.
Correct.
All right. Thanks, Mary, for being here.
Thank you, Jeanne.
Now, before we get started, I always like people to get to know who you are a little bit. And so if you just tell us, how long have you been with the VNA and what brought you here?
Okay. Well, I've been with the VNA about 12 years this time around. I always say this time around because before that I was with the VNA for about 6 years, left for a little bit, did a few other things, but always came back to the VNA.
Always came back.
Yes,
Good.
Right.
Good.
Since I've been back with the VNA, though, I got involved with emergency preparedness right from the day I walked in. We began with the county, at the county level in emergency preparedness. It was right after the 9/11, and we were looking to talk about how the community would respond to any type of emergencies. So it's really turned into an all-hazard type of emergency preparedness that we work with now.
So did 9/11 kind of precipitate a greater attention to being prepared, or was it always
9/11 precipitated that only for everybody sitting around the same table and talking about it.
Oh, good.
Barnstable County Regional Emergency Planning Committee now has the fire chiefs, the police chief from every town sitting at a table, as well as the health agents, the hospital, American Red Cross, IFAR. Everybody is really sitting around a table and talking about how to better prepare our communities for emergencies. And as a result of that, when there is an impending emergency, there are conference calls, and everybody is talking about what's going on in the community, and if we need to open up shelters, how we're going to do shelters appropriately, and how we're going to care for people who need the shelters.
So does the group that's such a large group conference call, that's a good idea, do they meet regularly, or is it only when something's going on?
No, they do meet regularly. It's important to keep those lines of communication open and to keep the talk about being prepared and to learn lessons from previous emergencies. So prior to an emergency, there's a conference call after the emergency, and after the shelters have been activated, there's always another call just to review what we did right, what we could do better the next time. So, and they do meet weekly. Meet probably about on a monthly basis, sometimes a little less monthly, but they do meet weekly.
I bet.
Monthly.
Well, I think because planning is a lot different than experiencing.
Right.
Even though the best laid plans, once you're actually going through it, it must be completely different. I mean, to look back on a situation or emergency that has just been handled, there must be a lot of lessons.
There is a lot of lessons that are usually learned, and like anything you do, the planning, and then if you don't look back and see how your plans went and learn lessons from it and then redo the plan again, it's the best method to keeping us going forward. But what we're learning is that we really need to teach people how to plan themselves, too, for emergencies.
Especially on the Cape, because people are sort of spread out and tucked away and at the long end of a road by themselves?
Right. And people do tend to be isolated. And again, our population is a little bit older than some of the city populations. So it might take us a little bit longer to get to some people. So we really need people to know a little bit more about making their own plans for emergencies. The Visiting Nurse Association of Cape Cod is really good about that. In our patient handbook, we actually have several pages that are dedicated to emergency planning and how our patients can prepare themselves for an emergency. And then prior to any impending storm, because we always look at those winter storms with the power outages, our nurses and our therapists all call their patients to make sure that they have their emergency plan in place and that they know what they're going to do should they lose electricity and who they're going to call, or they're going to go to a family member.
So is it... let's talk about that. What kind of emergencies do we have? I know this weather is certainly, because what a great year we're having already for that across the country, but right here, that's been one. What other kind of emergencies would we be talking about?
Besides weather?
Besides weather, or even besides a snowstorm. So we have a snowstorm, we have
snowstorm.
Hurricanes
we can have hurricanes in the summer. We've been very fortunate, but we can have hurricanes in the summer. High winds are our biggest emergency. That's what brings down our power lines. And whether it's a winter time where we might lose heat, or it's a summertime when we might lose the capacity to have water because we have well water and your electricity goes down, you don't have any water. So you really need to think of like the wind situation on the Cape. I think is probably our biggest concern.
So other than weather emergencies, so that's our biggie, is sort of weather emergencies. Is that right?
Right. I mean,
for most of our viewers.
For most of our viewers, it is the weather. I mean, we could talk a little bit about tornadoes are not completely out of the question. We've had some of those little wind tornadoes that have been spotted, and a couple of times that are called the microbursts. But again, that's a very high wind event that brings down some power lines.
Okay.
So.
Are we different than other areas because of the geography? Is the Cape different? Is it just the wind thing that...
We are definitely different than other areas because of our geography. We're stuck way out here on the ocean. And we're connected to the mainland by 2 bridges, sort of like little staples connecting us there. And if we have a high wind, they close the bridges.
Oh, yeah.
So, and we have kind of like one highway on and one highway off. So, people really need to kind of think about what they're going to do. If they really don't want to be left here on the Cape during, a power outage or a wind or a hurricane emergency, you need to get off the bridge, off the Cape well in advance.
Well, if we have well in advance
notice.
Does it turn out that we usually do?
For hurricanes and for snowstorms, we do.
Yeah.
Right. We have been sometimes in the past 10 years, we've been caught by surprise a few times by winds that were not really predicted by the weatherman.
The severity maybe wasn't quite
right.
Yeah.
Right. Yeah. So people really need to prepare themselves.
Did the evacuation route, those signs went up just a few years ago. Did that come about because of this group that meets?
Yes, it does. Yes, it did. Right. This group also meets with MEMA, which is the Massachusetts Emergency Management Agency.
Okay.
And then through MEMA, they have the connections with FEMA, which is the federal government.
Okay.
So this group really is responsible for getting that evacuation route plan in place as much as we're possibly able to, considering our own geographic constrictions.
Right.
And this group also meets with for the Pilgrim nuclear plant for that type of emergency too.
Yeah.
Right. And they're very active with that as well.
Okay.
So.
Good to know.
Yeah.
Just in case. So what are the basic steps for preparedness for the viewers that are out there that maybe haven't put a kit together or a plan, or what's their first step to be prepared?
Well, the first step is really to plan.
Okay.
That is it. And then set up a kit. And then so you know what you're going to do. But plan. Think about, just sit down and have that talk with your family. What are you going to do? Should you lose? And I keep going back to power because that seems to be our biggest emergency.
Okay.
But should there be some type of a disaster, what are you going to do? Are you going to go to do you have an off-Cape family member that you can share phone numbers with, and you can let that person know where you're going to be so other family members can contact you? Because
family members may not be here. They may be, so many are retired and settled here, and their families are someplace else. So.
Right. Have your emergency numbers handy. Not so at the very last minute, if you do have to leave the house, you don't have to run around looking for that phone book. Have everything kind of together in a kit.
So your emergency numbers would be these people that you're going to spend time with. So if your family comes looking for you, they know that's where you are.
Right.
Okay.
Right. And you also want to be prepared to be able to take care of yourself for a few days by yourself. So you want to always make sure you have your medications.
Okay.
So
if we talk about putting a kit together, would that be included in the kit, the medications?
It's a little hard to include your medications in the kit because you can't kind of put them aside, but you want to be at least 7 days ahead.
Okay.
So you don't want to let that last pill, when you take that last pill, that's when you call the pharmacy to get the renewal.
Okay.
You kind of want to do that a week ahead of time.
Okay.
So that you're never with that one last pill, and you can't get the pharmacy to deliver it. So always think about that. Always think ahead. think a little bit about water. Do you have bottled water in case your water isn't drinkable? Do you have enough for 3 days? Even if it means just taking some of those gallon milk jugs and cleaning them out really well and putting some water in that.
Oh, of your own.
Of your own, just for your own, so you'll have some. We think about maybe some dry food, some canned foods, just something that you can get by for a couple of days if you really can't get out of your house and nobody can get to you. First aid kits, any kind of clothing. If it's cold, do you have a sleeping bag? Do you have something warm? Do you have a hat? If it's hot, do you have shade? Do you have sunscreen? Things. Just generally think about emergency. Like, what would I do if I couldn't get out of my house? Would I be able to live here by myself for 3 days? And then if you do have to evacuate, you want to think about what would I take with me if we go into a shelter. Last winter, we did have several people who lost electricity for many days.
A while, yeah.
And they were cold. And they really you cannot stay in your house if you're cold. You might think you can tough it out for the first day, but after the first day, you really can't stay there. And then if you are older, and you have any other kind of illness, it's not even healthy for you to be staying in there. So you really want to think about going to a shelter where it's warm and you have a hot meal. And we have regional shelters here on the Cape, and we provide transportation to the shelters. So all you do is call your local police or your fire, and they'll send somebody to take you to the shelter.
Because I think I heard some of those stories of people that had their door to get outside was covered with snow, couldn't even push the door open. So how did they get somewhere?
Right. So you need to call the 911 and tell your police or your fire that you do need to get out. You have no electricity.
So what happens if phones are down? Do they
usually
look for you, or
they look for you? The police and the fire department are usually very good with. They have the phone calls where they'll make the phone calls to those shelters. Right.
Okay.
So if they're not getting an answer. But the other thing is that you have that off-Cape emergency person.
Yes.
That knows that you have this contact, and you made this arrangement that I will call you, and if you don't hear from me, then please call this police or the fire, and then they'll come out and they'll do a well-being check. You. Also,
so I have somebody, so a real life example, so just say I have somebody, so I'm stuck in my house, I have no power and my phones are gone, so I have no way of contacting someone to take me to a shelter. But I have prearranged with my friends off Cape that if there's any kind of weather event, I will call you and let you know that I'm okay. If you don't hear from me within 24 hours or whatever, right?
24 hours would be good.
Then would you please call the local police and let them know that you haven't heard from me?
Right.
Does that sound like, so people it should be so organized that they actually have something like that written, so we don't say, now what was I going to do again? And
that's right. It should be
how long was I going to wait?
It needs to be that well organized. It does, and there should be a plan written down. So this is what I'm going to do. So my friend doesn't get a hold of me. My friend is going to call so and so, and then that person is going to have check in.
Now, how do I know if there's a shelter?
They're on the TVs, it's on the radio, it's in the newspaper.
Okay.
Their local town hall. So prior to the event, they need to be paying attention to the TV, to the newspaper, to the radio, and they can always call their local town hall, and their local town hall will tell them if there's going to be a shelter opening up in their town.
So this last year, the shelters became open because of the loss of power, and it was cold. It was winter.
Cold.
And this year, we've already had a couple, but there were no shelters open, even though people might have been stranded because they didn't lose power.
We didn't lose power this year. What
is that sort of the determining factor of if
in the wintertime? It
is
the determining factor because you worry about the cold.
Right.
Your heat goes down, and you worry, and you also worry when there's no power and it's cold. People will start using their fireplaces and maybe haven't used it in a while. There could be a problem with that. People, if they have generators, they have to be careful. You don't want carbon monoxide poisoning. So there's a lot of other hazards that go along with not having heat. Because people really just want to stay warm, they want to stay home. So if there's expecting to be a storm where we might potentially bring down power lines, then our county will pre-open shelters. and we have like 4 regional shelters. But this past couple of storms that we had, we're also very good contact with the weather. National Weather Association, and there's a really good meteorologist that works also with that team.
Oh, okay.
And really, his predictions have been excellent. And the snow was light and fluffy, and it wasn't predicted to bring down any power lines. And star positions themselves here on the Cape now. They come down prior to the storm. They set up an emergency center, and they're ready to respond. And they've been doing a lot of like tree pruning and things like that to kind of keep the lines up.
Yeah.
So they're ready to respond very quickly too. And then again, all our emergency planners in every town are ready to respond. So the decision was made not to open up shelters, and it was a correct decision because we really did not lose any power. And during that storm, there were continuous conference calls with every town on those conference calls, advising each other about what was going on in their towns. So there had to have been some type of a really severe emergency, we would have been able to respond fairly quickly.
This is great, I think, for people to hear this, that just so they're aware of, yes, there's all this planning going on behind the scenes, and there's pre-thought to every decision that's made, and they're watching it well in advance, like the meteorologist that's on the team. I think that's fascinating.
Right, yeah.
So, but it does go back to the individual, that one needs to be responsible for oneself, and if there's an awareness of a storm coming up, to stay tuned, check with the town, your senior center, police station.
Your senior center is a good place to check too. They can all the senior centers. If you are a senior, all your senior centers are very much aware of you out there, and if you're on their call list, they will call you prior to the storm to make sure that you're doing okay, and that you've got what you need to get you through the storm, or they'll help you to make those arrangements to get there. Also,
so if you're on their call, so one would need
you want to register with your
senior,
with your council on aging and your outreach workers,
because
they will call you, and they want to be aware of you. If you're alone, if you have a medical condition, if you're on oxygen, if you're in any way fearful because you're alone and there's a storm coming up, call your council on aging and talk to the outreach worker, because they will help you to get through that, and they'll advise you if you need to go to a shelter, or they'll be able to, keep in touch with you and make sure that somebody comes out and checks on you if they can get in touch with you. So that's another really, really strong resource for seniors.
Yeah, that's great.
CORD is another one for disabled persons. If you're disabled and you're really concerned about being alone, and there's an impending storm coming up, if you contact your CORD caseworker, because they'll make sure that you have everything in place, that that you're not going to be left completely alone and isolated. Home care, Visiting Nurse Association, Elder Services. There's a lot of people out there that are contacting those that we know that are vulnerable during an impending storm, so that we contact them to make sure they're okay. There's always those individuals who maybe aren't hooked up with somebody. So, we still have to be a little bit more independent and make sure we're taking care of ourselves too, and still have that plan in place. So we can't.
So the plan and the kit of supplies that you need.
Right. And then if you do find yourself having to go, if you're going to a shelter because you really can't stay home any longer, or if the authorities are telling you cannot stay at your home and you need to leave, you want to make sure you take your medications. You want to take any assistive devices that you use. You want to make sure if you use a wheelchair to get from point A to point B, when they come to take you, make sure they take that wheelchair with you, or that walker with you, or that oxygen with you. Make sure that you think about those things, even if you have like a little checklist that's in your wallet, and say, make sure you go through your checklist before you leave the house, so you'll have all the important things you need while you're at the shelter, because the shelters don't have that.
Right.
So
I think we had some cases like that with last year's storm, people in the shelters that they were there for so long that the oxygen needed to be renewed, or they needed more oxygen.
Right. I mean, people can come with those small little tanks, but they don't last all that time. So you really need to make sure that, when you're leaving, that you get that extra one and take that with you too. And if you're making a decision because you're cold and this is an emergency for you, you may not be thinking quite as calmly as you would if you were planning that decision ahead of time. So you really want to plan it. and have that checklist so you know what you're taking with you.
Right. And does it vary seasonally? A little bit.
It varies seasonally. If it's in the summertime, there's still considerations of making sure you have your medication if you're going to be leaving and going to a shelter. Make sure you have your walker. You want to make sure you have your oxygen. It still varies a little bit because maybe you're not looking for that winter coat.
Right.
But, you also want to keep cool.
Yeah.
So you want to kind of think about that, and you want to think about if you go in someplace and it's hot, you want to be able to make sure that you stay cool, you have plenty of water.
Yeah. Are the shelters less likely to open in nicer weather? I mean, was it the cold that precipitated it just seemed like they were open people were in them for a really long time.
That last year was a particularly difficult time because we lost power for periods of time. So many people lost power.
Longer even.
Right. So people did need to stay in the shelters a little bit longer. Usually it's like a 24 to 48 hour thing. But we had shelters open, I think, a couple of days for some people because they just couldn't get back. They couldn't get the electricity back into the house to get them back into
so in the summer, if it's a hurricane season, a little less of a concern?
It might be a little bit less of a concern for the heat, but again, if you don't have electricity, you probably don't want to be in your house that long for any length of time.
Does that affect people that are
air conditioning? It would affect people with oxygen because they need to be registered with their local police department. There is that disability line that you can register with, so they know that if you lose power, you can get assistance. People that are homebound and use assistive devices, people who have respiratory conditions in the summertime that have air conditioning and need that air conditioning to make them be able to breathe with the humid weather. If they lost that, they would definitely need to go someplace. Right? Heat. If it's of extreme heat, they would need to go to a cooling center. Because it's just as bad having the extreme heat as it is having the extreme cold.
So for evacuation, can people be forced to evacuate? I mean, can they say, because we have that old Yankee spirit of independence saying, you can't make me, I'm not going. And you see it on the news and everything. I just wonder about that.
I don't know. That's a good question. If it's really a safety issue and it's like an impending roof's going to fall on your head, I guess you could be forced to evacuate. But that has to be a really extreme condition. Usually people are given the option. They're strongly urged. I mean, you do see it on the news that they stay and then they're stranded and the water's rising and they need to get out now, right? And that's not the best scenario to be in. So you need to listen to the emergency people in your town. If they're telling you that they're really expecting this as an emergency, don't think that they're just crying that the sky is falling. That they really put a lot of thought, they put a lot of planning into this, and if they're telling you that you need to get out, that it's serious and you should listen to them and follow their advice. Because if you stay and then you really need to be water rescued or airlifted, you've just put everybody else at risk that's trying to get you out of there.
That's a good way to think of it. You become a little bit more of a burden for everyone else to be pushing it that way.
And you're not in the best situation to get out either. So do it while you can plan it.
Right. And
do it under your own power.
But I'm not leaving without my dog.
That's what's really good because again we have this planning committee and IFAW and we have pet friendly shelters.
Animal Welfare
League. They've all met and I think every shelter that we have now, as it's a regional shelter in the Cape, accepts pets.
Oh, great.
So you can bring your doggie with you, or your cat with you, or your parakeet with you, or your monkey with you. They can't sit next to you in the shelter, but there is a pet-friendly shelter area for them in those regional shelters. So you don't have to worry. Don't leave them at home.
Yep, that's family for so many people.
It is your family, and you don't want to leave them at home. So, but now you can bring them with you.
Was that new within this past year that they've added that?
That's new. I think within the last maybe year and a half. But yes.
Because there was that, I'm not leaving without my...
That's right. So this committee has worked very hard to include, to be all-inclusive, to include every aspect of what it would take to help to keep people safe. And they've included the pet agencies, the animal agencies, the welfare agencies in this. And now I don't think there's Any one of them. I think they all accept animals now.
Does every town have a shelter?
No.
Options?
Every town doesn't have a shelter.
Okay.
We've gone to regional sheltering now. So we have the station like Mid, Upper, and Lower Cape.
Okay.
Every town has the option of opening up their own shelter if they'd like.
Okay.
And they all know how to do that, and they all have their own emergency plan for that. But the most efficient way of doing it is really to do regional sheltering.
Okay. And people will learn that by staying in touch and getting educated.
Right. And again, if you're elders, if you're 60 years, 55 years in some communities and older, you call your council on aging.
Okay.
And they'll direct you and they'll help you to make those connections.
All right. We've got like a minute left. I know. So just to review, the best things for emergency preparedness is a plan.
Have a plan in place.
Yep.
Have an emergency contact.
Emergency contact, okay.
And
a kit.
And have a kit. And the kit can be something as simple as having a 3-day supply of food and water and medications.
All right. So you can have a Rubbermaid tub with stuff in it.
Right.
Set aside.
Set aside.
All right. Very good. And to be aware of what's going on in your own environment. Try to stay tuned.
Right.
All right.
Yeah. Be aware.
Be aware. All right. Thank you, Mary. That's good information, especially this year. I don't know. Something about it.
Yeah.
All right. I appreciate it.
Thank you.
Thanks. And I'm Jeanne Sarnosky, wishing you good health and good health care.